I decided to step out of my comfort zone in my box 2 years ago and come into hospice, which has been very rewarding to me. I'm challenged every day, even with hospice, with different scenarios and different patient cases that come up with symptom control, that I learn something about a patient or medicine every single day. And I've been doing this since '97.
When you graduated high school, what did you want to do?
I've wanted to be a nurse since I was probably 13. My grandfather had a stroke and he was bedbound, and my grandmother took care of him at home. On the weekends, I stayed with her because she worked part-time on the weekends, and I helped take care of him. And so he always told me that he wanted me to be a nurse. And so that's what I've always thought I wanted to do. And I've been a nurse for a long time, but I am not a bit too good or ashamed to give a bed bath or to help. I have my hospice patients, if I walk in and the families are needing help, the patient needs a bath, they have soiled on themselves, I mean, I get right in there and I do it just as well as a CNA or a family member would.
This has a lot of room for CNA workers,
yes,
too, right?
Yes, we have CNA. They do the homes just as well as we do with giving the baths and helping out with little. They can help around the house with little housekeeping. We have a couple of patients that think because of hospice and because of what our aides do for them, that's what enables them to be able to stay at home alone. Because a lot of our patients that have a lot of lung problems and shortness of breath, they're not able to ambulate for very long periods of time, and they may have a few dishes that needs to be washed, and so our home health aides will wash the dishes for them. They will sweep the living area for them. Just any little thing like that that we can do to try to help these patients stay at home in their last months is what we're all about doing.
And that's what I don't think they really understand hospice. I've mentioned what hospice is, but can you give a little background?
Hospice, we take care of patients that have a life expectancy of 6 months or less. A lot of people think that hospice just serves cancer patients, and actually cancer patients is pretty low on right now of our major diagnosis of what we serve. We have a lot of congestive heart failure patients, a lot of our pulmonary COPD patients, we have a lot of heart disease patients. And we try to facilitate keeping that patient at home and keeping them comfortable, and for them to be able to maintain the best possible quality of life that they can during most 6 months. With adjusting medications, we try to not keep them in bed, try to not keep them sleeping. We try to let them be able to do the most that they can do in their life while they have left here with us, along with keeping them comfortable. I have a patient of my own now that we've done a lot of medicine changes. He has cancer, and it's very widespread. He's still working in his garden. He's still planting his own garden, mowing his own yard, you know, and just living what life he has left to what he wants to do. We have social workers that also go out and visit the patient at least twice a month. They help our patients with, you know, if they need to apply for Medicaid or Medicare to help pay for their bills and their medicines. They assist them with getting the commodities from the programs locally that gives the free food away. They assist with their bills if they need help with bills. We have a special needs program at hospice that is set aside for just helping patients with special needs. We have families that have children that live states away that are not able to get home and see their loved ones. We help facilitate that with our special needs money, with bringing them home to see maybe their mother or father for the last time. We have a couple of patients that have celebrated anniversaries that have wanted trips. They facilitated a little trip to Gatlinburg to pay for those things. Help with medicines. We provide most of their medicines that are, well, I did to while we have them admitted to hospice. Their medications are shipped straight to their door. Family does not have to try to leave and go out and get medicines and leave that patient there. We also have our chaplain services that go out once a month and provide a lot of support for the family, and more often if needed. Chaplains play a big role for us. We've had patients that have not believed in God or had not been baptized, and be their last dying wish that they be baptized, and our chaplains have done whatever they can do to try to baptize these patients with a tub of water, sprinkling water over them, to just try to give them their last dying wishes. We also have our volunteers who, if the family wants and the patient wants, that can go out. They can go out once a week and provide up to 4 hours of free services. They can sit with the patient while a family member can go to the doctor, run errands, just get out of the house. They can also run errands, go get groceries. If it's a patient that lives alone, they can go get their groceries for them. They can just provide support just to be there if they're just wanting somebody to talk to. You know, each patient is just individual to what their needs are, and we just kind of have to, you have to be flexible with hospice because each patient and each family, their needs are very different. Some might want us to just come in and be lovey-dovey to them, and some kind of have their little box that they're just not real accepting, and you just kind of have to work your way into it. And for nurses, and I encourage each of you that if you feel like that's what you want to go into, that it's very rewarding and you're always going to have a job.